you could just kind of explain to me your understanding of what the FDA changes and CDC changes now mean on the state level, and how that plays into someone who wants to go get vaccinated but may not be 65 years or older and may not have a quote-unquote underlying condition.
Where do you want me to look at her?
Just look at me, right down the middle.
There,
Yeah.
yeah.
So you want my name and all of that first?
I mean, if you want to, I know it.
You know.
And I know how to spell it,
You'll
but if
have
you want to do that.
all of that.
Yes,
Okay.
sir.
Yeah, people don't understand the differences between CDC, FDA, and NIH when it comes to vaccines. The FDA approves them, and there have actually been significant changes, but they're mostly on the pediatric side.
Mm-hmm.
Once it's approved, it needs to be recommended so we can give that or know who to give it to. And that is what a subgroup of the CDC does, called ACIP. That is what's now famously known as RFK panel, which he dissolved and put his own people in there. And they come up with the recommendations how to use these vaccines. And the last time they met was, a big chunk of it was about COVID vaccines. So in the end, we have several changes from that, because the FDA had an approval for a COVID vaccine for babies and for healthy children. That was the Pfizer vaccine. There's two others, including the Moderna vaccine, that is licensed for children that are slightly older and have certain conditions. The approval for the Pfizer vaccine was based on the initial emergency use authorization, and they just withdrew that. Within a very short time, they just stopped that. They can, but usually if that's done, it gets replaced by a full approval. They haven't told Pfizer when that approval could come, if it's gonna come, and certainly we don't have enough vaccine right now for smaller children, because A, Moderna doesn't have that approval, and B, they cannot go on standby and get enough vaccine out. So that's changed on the FDA side and approval. On the recommendation side, how to use it, ACIP or the RFK panel, they met and they decided to change it from previous years. It will be recommended for anybody over 65. They will recommend it for people under 65 if you have specific condition, and there's a very long list. For most people, not you, but for instance me, obesity counts. That should cover about 3/4 of the state, and you don't have to have much thought. But the important ones are obviously lung conditions, heart conditions. What's completely dropped off is actually the most important use of vaccines is community health. I get the vaccine not because I need to protect myself. I've had vaccines and I've had COVID 3 times. It'll not be more than a sniffle going forward, but some of my patients can ill afford me getting COVID. So I will get the updated vaccine, which comes out in September, October this year, a little delayed with this delayed approval process. But theoretically, everyone who wants the vaccine can get the vaccine. Because of the recommendations coming in so late, all the pharmacies needed to decide what they wanted to do with it, and they all decided to do something different. The South Carolina Board of Pharmacy, let me need to do anything else?
No, I'm marking time just because it's a little bit later in the afternoon. I want to make sure I get my good points in. But the Board of Pharmacy, I'm sorry, go ahead.
So the Board of Pharmacy decides for South Carolina how pharmacies should apply this, and they said we have no recommendation. Don't do it without a prescription. The panel that had met said we don't need a prescription. We still don't need a prescription, mostly because they couldn't vote on it, get enough votes to stop giving it freely or without a prescription. So now the recommendation is that you consult a healthcare professional and then decide whether you need the vaccine. Again, I think it's an incredibly good and effective and well-tolerated vaccine. It still not only prevents severe illness, but it has a significant protective effect from long COVID. If you haven't had it and don't know whether you fall into that field, this is a significant problem for a lot of people. I see a lot of immunocompromised people. So you want to vaccinate me so to not drag it into that room. And that's the basic recommendation we have. So for us, nothing has changed. However, since the advisory panels have changed, the confusion that was created with this was pretty significant.
And that was essentially what the crux of everything was the confusion on everything. So for someone in the state of South Carolina that does not, we don't have Department of Public Health guidance yet. What should they know, or what should they expect anything different going into their CVS, because it's not at their primary care facilities or at clinics yet, the new doses that is.
So most facilities, including ours, which is the largest in the state, does not have the updated version yet, mostly because we didn't know what was gonna happen, so nobody knew how much to order. All the large pharmacies have it now, and they should all know what to do now. So they should not ask for a prescription. They may ask you, have you considered to talk to a healthcare professional, and then you should get the vaccine. What we haven't talked about is coverage, right? So insurances, the private insurers have decided to fund this through the end of 2026. So there should be no problem with that. DHHS, which oversees Medicare and significant other payers, has not given guidance to what should happen, or with people who are not insured is another problem. Primary care should in a very short time be able to give it. We expect ours any day now. But pharmacies have that, and I've talked to CVS, Walgreens, Publix, and Kroger, which are around my house, and they all know essentially what to do. I just called as a provider what happens if I call this in. We will give the vaccine. But before this panel met and some of these decisions have been made, everybody made their own rules because no firm recommendations were given out, and it ended up with a significant chaos. But if you were turned away 2-3 weeks ago, it should be resolved now, and you should still get it.
Is there any timeline that you guys have at this point on when you'll receive doses? Will the Department of Public Health will receive their doses? There's a timeline on that yet?
Any day now. I have no idea.
Right. I know they said October. I just didn't know if it was October 1 or 15.
Yeah, it should have been there several weeks ago. The companies have enough to get it out. It was just difficult to estimate what the need would be depending on the rules of engagement that we didn't have at the time.
One question also that came to mind as you mentioned that availability, because you were talking about Moderna and Pfizer earlier. Is there going to be a shift in availability with these new doses?
No, and it's the same technique. We don't expect anything different. We don't expect any change in side effect or efficacy of this. It is based on a newer virus, but essentially the same process that it's given, and we expect that there will be enough doses. The one big advantage of mRNA vaccines, other than that they're so well tolerated, is that they're easily changed and actually not terribly difficult to make. So they should be able, even on a shortened timeline, to get enough doses out.
Okay. One final question I have, and of course, if there's anything else that you want to add for the story, feel free to do so. But just circling back to the point you made earlier, there's been changes on the federal level, but as a infectious disease expert, are you still recommending that everybody, take a booster, get vaccinated ahead of, peak cold and flu season?
Yeah, everybody needs to make their own assessment, whether they have more benefit than downside from it. For me, very clear, I will get it. I get it for other people. Most people in the community should think about not only themselves, but what they should do. Young people are very socially mobile and see a lot of people. So just because they won't die themselves, they may get in contact with someone, if they have COVID, that will die. So I think it's a good thing for our community, for our population, that we get immunity up, and there's two ways to do that. Once you let everybody get that, which is not safe, or vaccinate as many people as you can. And since there's such a good, so much more tolerable vaccine versus COVID, I still come down, everybody get the COVID vaccine if they can, if they want to.
Rebecca?
I would just ask you, what are you seeing right now? Are you seeing many COVID cases coming into your office already?
So we had the big post-summer surge, which is now, and actually in the last 2 years, been much larger than the winter surge of COVID. We had bad flu seasons, and that is dependably still for South Carolina in the beginning of the new year. We're gonna get it. We right now have extraordinarily little flu in the community, but the big outbreak of COVID is actually going down. If you in the last couple of weeks didn't know somebody who had COVID, it seems to be everybody has gotten that. One of our problems with all of this, there's no more research into these vaccines, there's no more funding going into this. Personally, I think the question to ask now, should we stick with the winter vaccine for COVID, or should we push it to the summer? My understanding would be that we should at least look at this with the significant summer surge that we've been seeing. Now, if you get vaccinated, you're too late if you had it in the last couple of weeks. So it's one of the things that we would have a couple of years ago just studied. Right now, we're not able anymore, right? There's no more funding for these kind of questions. But I think from a general understanding on how this epidemic is evolving, we should at least look into this, whether it's not better to change the vaccine schedule for COVID. But again, right now, it's just not a time to look at this.
I did see that on the DPH website, just the data tracker, it curved significantly in August, at the end of August.
And our numbers are not reliable anymore, right? So we get good hospital numbers, but very few go into the hospital anymore. Deaths are rare. But everybody does home tests, right? So we get our data from the emergency room. We get percentage of positive tests. We do COVID tests, and 10% come out of positive last week. In early summer, it was less than 1%, right? So that's how we see that there's a surge going on. I use my own index, the so-called Albrecht index. You heard it here first. If I get more than 3 calls before lunch for Paxlovid, then there's an outbreak. And over the last couple of weeks, I did get a lot of calls, at least a question for this. But overall, if you have COVID, that's, I think, one more important thing. If you think you may have COVID, if you have any of the sniffling viruses, care for others, right? Be nice about this. If you have to go in, go with a mask, wash your hands. It prevents half of these things. And so still behave like we should in an advanced country like this to stop the spread of these things.
My only thing was, I know we've talked about this in the past, but you would still say it's okay for us to take more than one vaccine at once. For instance, if you're going for the flu shot, it's okay to get your COVID shot at the same time.
Yeah, next year they'll be actually combined in one syringe, I think. But it's, yes, you have 2 arms, there's no problem with this. If you have an immune reaction to it, it's not a side effect, but if you feel achy, if you get a low-grade fever or something like that, that's actually an effect of the vaccine, not a side effect of it. And that you need to hang low for a day or 2. Why not get that out of the way on the same day and be done with it and only suffer through the 24, 48 hours once. None of the vaccines have whole virus in it, so they can't give you the flu or you can't feel achy, you can feel flu-like, but you can't get the flu or COVID from these vaccines. There's not a full virus in it.
I think I'm good.
I'm good too.
Awesome. Dr. Albrecht, thank you. Thank you so much.